First time of getting adjusted, right?
Yes.
First time, we jump right to the video.
Yay!
Okay. So we've had a few video people that have never seen chiropractic, just first time getting adjusted. So we're gonna use chiropractic care to address some of your issues. Okay. So a little bit of low back pain. Anything that occurred that made it start hurting?
Standing for hours at my job.
Okay. What do you do for work?
I work at Gold's Gym front desk.
Got you. Okay, so standing for long hours starts to feel a little bit of pain or tenderness within the lower back, and here we are for some care. Okay, so from a chiropractic standpoint, we're gonna try to loosen up the lower back. Right, we're gonna create range of motion and get some mobility within the spine. Okay, to loosen up some of the inflammation down there. Okay, are you doing any rehab or training there at the gym?
No.
No? Okay. So we're going to give you some low back exercises that you can focus on, okay, to try to help give you a better core and foundation to sustain those long hours of standing, okay? I'm going to go from there. So right now I'm going to do a couple of little orthopedic exams to see if they come out positive and see if we're dealing with something a little bit more aggressive than your common tenderness and tightness and sprain strain type issues, okay? So we'll have you stand up right here for me, okay? And face the knee without actually touch your toes for me.
Oh yeah, that's not happening.
No, okay. Come back up. All right. Any history of any back issues, scoliosis, anything like that? No. Okay. And then I see your posture's kind of like veered a little bit to one side versus the other.
Yeah.
Is this something that you've been noticing now?
No, this is always.
This has just always been like that. Okay.
I always do this.
So like put your hands on your pelvis right here, okay? And find your hip bones there, right? And so I see like it's veered to one side and you feel like one side is longer than the other, okay? And so try touch your toes again for me. Okay. Come back up to neutral. All right, and I kind of see your hips kind of shift back into that position again, okay? All right, so I'm gonna do a little bit of checking on your spine here, okay? So have a seat right here facing that way.
Do you want to tell them about your leg too?
Oh yeah.
Let's talk about that.
I have a pinched nerve from like here to here. It's completely numb. It's been numb for 4 years.
For 4 years, okay, got you. All right, do you remember what caused that?
I fell down the stairs.
Fell down, got you, okay. Good. Do me a favor and lean forward. Okay. Good. I'm doing a little bit of palpatory check or palpation check here, okay? And I would probably, on you, order x-rays to see how your spine looks here, okay? Just because as I'm noticing the way you're standing, noticing how your hips are shifted, right? We might want to take some x-rays to see if there's any presence of scoliosis here, okay? There is a scoliosis test that, remember I don't know if you remember, but when you're a kid, somebody comes out and checks your spine at school, where they have people kind of bend forward and see if there's like a little bit of a hump or a curve. Did anybody ever mention anything like that on you?
It might have happened when I was like really little.
Yeah, okay. And a lot of this with the fall, did you remember your hips being off-center before the fall as well?
No.
No? So possibly maybe since the fall, have you noticed, just really don't know when that started happening?
No, I remember I really messed up my knee.
Yeah.
And the knee got better. I can crack it whenever I want. It's really nice. I don't think that's normal. And then this just became numb. Like people can hit me, I'm like, whatever.
You don't feel anything, right? And when you did fall you on the leg there?
Yeah, I kind of slipped down and I bruised up the knee really badly.
Yeah.
And then I went to the doctor. Because I couldn't feel anything.
Right, just let it heal. Yeah. Okay. I'm gonna do some palpatory checking. Just kind of look at the different how the legs look as you're laying face down to see if we see a leg length difference. Okay. We would do something a little bit more detailed as far as like checking for leg length for you specifically. Okay. And like I said, it's our first time meeting, coming in, kind of assessing what I'm seeing from a postural standpoint before we get started with anything. And so there's a few probably, as you kind of start to do an exam, you detect a few things that you say, oh, this is going to require a little bit further follow-up, okay? So we would discuss a couple of those different options. For the purposes of today, we're going to get in here and do a chiropractic adjustment, just get some good spinal alignment, get some good good spinal mobility in there, and then we can talk about what we can order from here forward, okay? Any questions with that so far? Pretty straightforward, right? Okay. All right, so I'm going to remove this here, and I want you to lay face down right inside this face paper right there for me. Okay, and I'm going to feel the lower back. Okay, relax here for me. Okay. All right. So tenderness with moving around like that? Any tenderness in the lower back when you're moving around like that?
No, not really.
No. Okay. All right. Relax right in here. Okay. So we definitely notice a difference in leg length right there, okay? All right, relax right in there for me. Okay, just relax your knees. Let me bend them. Any pain in the knee?
No.
Any pain
Oh
within?
God.
Where's the pain at when we do that?
My thighs.
Your thighs? Both sides or one side?
Not the pinched area, it's more like the front.
More on the front of the both sides or more on the front of the right side?
Both sides.
Both sides, okay. Any pain in here? No?
Ah, yes.
Right there?
Ow.
Okay, yeah, okay. What about in here? Right here, yes, yeah,
yes,
okay.
ow.
So right there, we're feeling a little canal where our nerve roots come out, right? And so in this little canal, we definitely have some irritation, right? Kind of like you go to the dentist, they kind of check your teeth and they find a hot spot and they put some air on it and it's like, oh, that's painful, right? So that's the similar kind of pain that you're feeling as we're feeling this inflammation in that joint there, okay? And so it is right at at L5S1, okay? So that's where we have a little canal where nerve roots come out of, little disc irritation. It could be from compression from standing, okay? But I'm assuming that fall had something to do with this, okay? So we're gonna, like I said, for today's purpose, we're gonna perform some chiropractic adjustments, do some electronic stimulation, okay? As we're, like I said, we're checking leg length, we're checking palpatory examination to see what we got going on in there. None of your symptoms that you're reporting are screaming out like disc herniation, okay? But definitely we have some irritation in that lower L5S1 region, okay? So we're gonna, like I said, types of therapies we use. You've never had this therapy before, so I'll kind of explain a couple of things for you. Electronic stimulation, okay? It's a muscle stem or a transischemic nerve stimulation unit, okay? So we place it on this area. It creates a micro massage, brings blood to the area, helps with circulation, lymphatic drainage, okay? And it helps, what's the purpose? To kind of remove the little tender area, which you're not really feeling it unless I press in there. But as you feel the machine, you're going to feel that micro massage on that area. So we're trying to remove some of the nerve stimulation, trying to decrease that pain sensation, trying to increase circulation, lymphatic drainage in there. We'll use some hot packs as you're laying here. Hot packs are going to, again, bring blood to the surface, get things nice and loose before we adjust you, okay? Once we do that for about 10 minutes, once that's done, we'll get back in here. I'll use a little bit of a healing gel, okay? I'm not gonna do some deep soft tissue work on you today, okay? Because I definitely wanna do some further studies or recommend some further images just for future purposes, right? I'm gonna use a little bit of lotion here and then a full body adjustment, top to bottom, okay? And then after the adjustment, we're gonna send you to a machine where we can demonstrate some deep stretches in the lower back.
Okay.
And go from there, okay?
Okay.
Any questions? Nope. All right. Let me know if there's any throughout the process, okay?
Okay.
I'm going to set you up here. So rest your body right in here for me. And I'm going to set up a couple of electrodes on you here. All right. Relax right in here. A little nervous?
Yes.
Yeah? Okay.
100%.
Okay. You feel that tenderness in there?
Yes.
What about there? More right here?
Oh my god.
Yeah, okay. I'm going to put one right over here, okay?
Okay.
All right.
Is it gonna hurt?
So we're going to take this machine up to your tolerance level, okay?
Oh god.
So your tolerance level means like you might hardly feel anything as we're applying it, and then eventually we get to a point that, you know, something you can handle. But when I tell you, you want kind of like a therapeutic feel, so you want it to kind of feel like it's contracting in a deep stimulation, but we don't want to reach the pain level, okay? That could be a difference of 1% of the machine. An example, you could be at 34% and it kind of hurts. We drop it down to 33% and it feels amazing. Okay, so we'll go up to your tolerance level. Okay. Okay. All right, relax right in here. Okay, so here comes the machine. You're gonna start feeling this here. You start to feel something right in here.
Yeah.
Yeah, like kind of ticklish or a little bit of
That feels good.
Yeah, good. Okay, we're gonna go up to your tolerance level and go up a little bit more.
Okay. tickles. Oh my god.
Does it tickle a little bit?
Oh
Okay.
my god.
Does it kind of tickle a lot?
Yeah.
Okay, we're gonna drop it down a little bit. How does that feel there?
Good.
Good? Okay. All right, so that seems to be a level that's pretty good for you?
Yes.
All right, so some people with this type of machine are gonna get different sensations. Some people feel like it's needles. Some people feel ticklish. Some people feel a deep massage / contraction, right? Other people don't feel anything. And we gotta take the machine up to a level, and I finally decide, okay, that's kind of enough. We don't have to go any much higher. So all of these responses that we feel is your body translating that message, right? And so right now, how is it feeling?
Feels pretty good.
Feels pretty good. So the difference between 27 and 24 went from tickling, kind of making you giggle and move around, to feeling pretty good.
Yes.
All right. So as you see, the different frequencies and intensities on the machine will create a different sensation here. Okay, so we're gonna let that machine run for about 10 minutes. There's a couple of armrests right up here, right down here.
All right.
So you can relax a little bit there. We'll let that run for a few, and then I'll be back here shortly. We'll continue, okay? All right, thank you. Hey guys, it's Dr. Diaz again with Momentum Chiropractic and Rehab. We have Jana here, and she is a first-time chiropractic patient. You'll see during our assessment video where we talked about different issues that she had going on, primarily low back, a little bit of issues with posture in her hips and her standing posture. Definitely found a hot spot on that lower left side, right? We've also done some palpation here in the upper traps, right? We noticed some anteriorly rolled traps, a little bit of tightness right in the upper traps as well. So we're gonna now proceed and demonstrate a seated cervical adjustment first, okay? After the adjustment, we'll proceed and go to the lower back and go from there, okay? So we're gonna adjust right in here first. We can set up right over here for adjustment. You stay right where you're at, Jana.
Okay.
Right there. Okay.
Oh god. No.
Feel tightness there?
Ow,
Yeah,
ow,
okay.
ow.
Relax right in here for me, okay?
Oh, please don't crack my neck.
No, okay, we'll leave your neck alone.
Okay.
That's fine.
I'm
Yeah.
so scared of that.
Not a problem, it's okay. All right, so we're gonna skip the neck movement here, okay? So we're gonna jump right into a laying face down adjustment here, okay?
Okay.
So go ahead and lay face down there for me. Okay.
Oh.
And we're gonna go here. Relax your arms, relax down there, relax
Yeah.
your arms down on the side. Okay, so we had checked her leg length prior to using the electronic stimulation, right? And I just wanna kind of demonstrate here. We have not done any adjustments yet, but we did apply the electrodes to the lower back, did some stretches on the anterior part of the quads, and all of a sudden we have some better leg length, right? And so we wanna see how she is when we stand her back up after the adjustments, to see if the adjustments and the machines have improved some of the pelvic imbalances that we were seeing as she was standing there, okay? So we're gonna go ahead and adjust right through here. All right, relax right in here. I'm gonna use a little bit like of a healing gel here. Okay, so remember that area right there, tender right in there. How's bad over here? No? But right here, yeah, okay. Relax in here, okay. We're gonna adjust through this part here, okay? So take a deep breath for me. Completely exhale. We're gonna go super nice and gentle.
Oh my god.
Okay. All right. Okay, I'm gonna adjust your lower pelvis here. So lay on your side facing this way for me. Right over here. And then bring that arm out this way. Rest your head right there for me. Go top leg bent, bottom leg straight. Right here, relax your hips here for me, okay? Give me this arm right over here. Right there, rest your head right in the center, okay? Right there, okay? Take a deep breath. Completely exhale. Good, good, okay? Lay on your side facing the opposite way for me. What did you feel in there?
I feel better, it's just
Feels a little different, right?
yeah.
All right, relax right over here. Rest your head right, rest your head right in the center there, okay? Right in here. We're gonna try to get movement through this joint here, okay? Breathe in, all the way out. There you go, good. Lay face up for me on your back. All right, see that movement that we had in there? Okay.
Yes.
All right, rest right there for me. Lay your head back that way. Okay, good. Again, I'm just kind of checking for leg length differences here. And I'm looking at her hips, as earlier when I was evaluating just on her standing posture, we had a hip hike versus the other side. Good. Okay. Relax right in here for me. You're good. It's all right.
I trust you.
You're not the. This is a common reaction. Okay. Some. Good. Okay. Let's check your standing posture here. So we're gonna help you up here.
Okay.
Okay. And then we're gonna stand you back up where we started at the beginning of the visit, right over here. And then I'm gonna have you face me, and we're just gonna check to see if there's any differences right now in just standing posture. Okay. So. Hands on your hips here, okay? I still see the little bit of hike to one side, but not as bad as it was before. Do you feel any difference in your pelvic balance right there? Kind of? Okay, what do you feel right now on your lower back?
I feel very relaxed.
Very relaxed, okay? So see if you could touch your toes for me.
To be fair, I've never been able to do this.
Good,
So.
got you, good. Come back up. Any pain with that there?
Just right there.
Just right there, okay. And then we'll definitely discuss a couple of differences in posture and how we can improve this stance. So one thing I'm noticing right now just through your shoes is how your left foot drops a little bit. Do you notice if you have like a flat arch on the left side or flat feet?
No, I don't have that.
No? Okay. All right, let me just kind of stand right where you're at here. Okay, and we're gonna support here, right there. Now stand. Okay, and do you feel the difference there? Put your hands on your pelvis. Okay. Do you feel any difference in balancing in your hips there?
Not really.
Not really? Okay. And then as we let go, did you see that automatically kind of like rock in?
Yeah.
Okay. Same thing here. Relax there for me. Okay. Remember, I'm using just my hand just to palpate, so this does not mimic any type of orthotic or structure. Okay. And then just stand normal. You're not gonna hurt me. And then as I let go, see that rock?
Yeah.
Okay, so definitely we have some, we can address a couple of different things, okay, with the arch. So there are some arch strengthening exercises, okay? We're gonna start you off with that. So there's some arch strengthening exercises we have up front here. We'll have that printed out that you can start strengthening that arch. And again, I'm noticing it more primarily on the left side. Mm-hmm. Very likely it's gonna be both sides. But we saw when we had stability there, and when we let it go, it rocked a little bit, right? Mm-hmm. So that definitely can be what's causing a lot of your issue in your lower back, okay? Because as our arches drop, the pelvis rocks forward. That pelvis rocking forward is going to irritate the lower back and have you cause you lower back pain. That's why long periods of standing causing your issue. And where is your issue at? Right side or left side? Yeah. It was that left side, right? So does that make a lot of sense how that chain from the bottom all the way up? That's something we're observing throughout the visit, right? Okay. So we're gonna try to start working on your arch, your foot arch. We want to possibly, in the interim, while you're strengthening that arch, having a nice solid orthotic or arch support in your shoe, or a better shoe with better arch support, may be ideal to creating that balance there, right? So even though you don't visually see like you're anything flat-footed, right? We definitely have some interior veering that's causing your pelvis to be off-centered. Okay, so correcting from the ground up, a lot of times is going to correct everything up through the hips.
Yeah, well, I know I need new shoes. These are very old.
Yeah, so we'll give you a couple of recommendations for some local stores here to get in here and create some support and get you a good balancing there, and you'll see the difference as you're standing when you do have that balance and that support within your arches. Any questions? Pretty straightforward, right? All right, good to meet you. Thank you very much. All right.